Hi everyone, Dr. Remy from Posturesize. Today we've got some great personal training assessments for preventing lower back pain with degenerative, bulging, and herniated discs. We're going to be examining the assessment and correction of internal oblique dominance. Hope you enjoy. So one of the key assessments that you need to do with clients that you're personally training with a history of lower back degenerative discs or disc herniation is to check the function of the internal oblique muscles. Remember, the internal oblique is a muscle that creates a force from the pelvis up to the abdominal area that turns our upper torso towards the same side. It lays underneath the external oblique. Many times with chronic lower back pain disc disorders, clients will have a tendency to have one side of an internal oblique muscle become dominant over another. That's due to a reflexive nature or protection from lower back pain, as well as posture habits and asymmetrical activities that they get into during life. The test that you need to do is if you palpate or feel a client's front hip bones, if you just go down the side of the abdomen, the very top of the pelvis, that's a little bit below the belly button, and come in, you can even have the client place their own hands there. As they draw their lower abdomen in for this assessment, normally the deepest abdominal muscle, the transverse abdominis, will pull the entire abdominal wall inwards towards the spine, away from the client's fingers or away from your fingers. If you notice, or the client notice, when they pull their lower abdomen in, that one side doesn't pull in away from the finger, but rather bulges out into the finger, that indicates a dominant internal oblique on that side. And when an abdominal oblique is dominant, with all abdominal motions for core tensions, they're going to have a tendency to rotate their upper body towards that side. The torquing may be very slight, but the net effect will be a twisting on the vertebra in the lower back. And one thing we know about discs is that they're susceptible to trauma and injury when they have flexion or bending forward, and especially when they have flexion combined with rotation. So if you have a client that demonstrates a dominant internal oblique muscle, every time they're using the abdominals, whether they're doing a straight plank, whether they're doing an inline plank, whether they're doing a clean and jerk and a split stance, anything that has to do with flexion or rotation, they're going to have a tendency to tense that abdominal oblique on that side internally in a way that's asymmetrical from the other side. And that's going to create a slight torque on their spine into that direction, towards the same side that the weak or the dominance is on the internal oblique. So to correct this, what you need to work with your client before you actually perform the exercise for a few repetitions is to practice pulling the lower abdomen in slower and deeper on that side so that they can control the relaxation of the abdominal oblique, and that dominance is then inhibited. So you want to have an equal pulling away from your fingers from right to left. And by slowing down the speed at which they pull their lower abdomens in, engaging their transverse abdominis, and thinking that that side has to pull in a little deeper as well as slower, you'll be able to train them to have a symmetrical engagement of the internal obliques when they engage their core by using their deepest muscle, the transverse abdominis, pulling in the lower abdomen. After you do this, you can abdominal brace as if you're going to get punched in the stomach, and then go about your abdominal work. The other key you should consider with your training with these clients is that any type of rotational movements to one side or another, whether it's a medicine ball, whether you're using cables, whether you're using leg raises, you should always end into the direction that's opposite of that internal oblique. If your client has a dominant internal oblique on the left side, that rotation towards that side should be done first in the sequence of your exercises, and you should end with rotating away so you leave that internal oblique muscle relaxed and stretched and have a contraction of the opposite side, which will recruit the opposite internal oblique, bringing back balance to the body. And after workout, you're going to leave your client in a corrective direction of trained workout stimulus as opposed to a dysfunctional state if you contract those same muscles rotating into that side. Plug this into your training, help reduce the chances of injury for your clients with disc problems, degeneration and herniated discs with abdominal training or any type of core work that's utilized in more compound movements. If you like this video on internal oblique dominance and low back pain avoidance, Feel free to subscribe to our channel. We got a lot of great videos out there, not only for learning how to avoid aggravating clients with back pain, but shoulder, hip, knee, etc. Join our channel. Got a lot of great tips for you. Questions or comments, write in. I'll do my best to answer them. If you're looking for a great program to learn how to assess, how to design programs, and how to implement modification and exercises to prevent hurting your clients with pains and injury conditions, feel free to go to the posturesize.com website. We've got our famous essential crash course, which teaches you everything you need to know about assessment, program design, and exercise modifications to avoid hurting your clients and getting the most out of their workouts, avoiding losing them due to injury, and increasing your referral base due to your level of expertise. I hope this video on internal oblique dominance and low back injury helps you with your clients with lower back pain.